Can expect to receive their portion of the $2 trillion stimulus package within the month of April. KRCG 13's Elizabeth Hoffman got some expert advice on how that money should be spent. She joins us now live from her home.
That is right, Kermit. So many Americans have been hit with lost wages during these very difficult times, and many will be glad to get this extra financial help. Now, most people will not need to do anything before receiving this money. Taxpayers who filed tax returns for either this year or last year will automatically receive payment of $1,200. That's for individuals, and $2,400 for married couples. Now, parents will also get $500 per qualifying child. Now, those making more than $75,000 a year will receive less than the full $1,200, but that depends on how much they make. Those who make $99,000 a year or more will not be eligible. The IRS will automatically deposit the money in the bank account that's reflected on your tax return, or if your refund was mailed to you in form of a check, that is how you will receive the payment. Now, for those who are fortunate enough to still be working and you don't have a financial hardship, experts say to be very careful before spending all of that money.
People need to be very aware of their financial situation, make sure that they've got cash set aside for emergencies or some place they can go for emergencies, maybe a line of credit, a credit card, if worst comes to worst, so that if they do lose a job or have a big decrease in pay or something else comes along, an unanticipated expense, there is a way to pay for those things without putting yourself in dire straits.
Now, most people will not need to do anything to receive the funds. However, Social Security recipients, veterans, and those with disabilities will need to fill out a simple form, and that can be found on the IRS website.
Symptoms and criteria for testing patients suspected of infection by the coronavirus have evolved. KRCG 13's Ashley Eddy today spoke with an MU healthcare emergency physician. She joins us now live from Columbia.
Kermit, MU healthcare officials tell me, unlike before, tests are more available, and if you need to get tested, you're more likely to get tested than not.
Dr. Chris Sampson, MU healthcare emergency physician, says strict requirements around coronavirus testing had to change due to the virus becoming community spread. Now, Sampson says if a patient has symptoms of the virus, they can set up a virtual visit with MU Healthcare through a phone or computer.
We will refer people to our drive-through testing center located near the Hearn Center. You actually don't even have to get out of your vehicle. You just pull up in your car. There's nurses there who ask you a few screening questions, confirm if you've been seen, and we'll check the order for the testing. The testing then involves a small nasal swab that's just placed up your nose. It has to actually go very deep because it has to get way into the back of your nasal passage.
Once tested, he says results can be seen within 12 to 24 hours. But as time goes on, Sampson says they are taking into account patients' symptoms can really vary.
There are some people who just have muscle aches. There may be some people with GI symptoms, so they may have diarrhea. They may just have fatigue. So some of the more mild cases don't necessarily have the respiratory symptoms that classically we were looking for in the beginning.
And although in a small number of cases, Sampson says new symptoms are being seen, such as pink eye and the loss of smell and taste.
Really, with any viral upper respiratory disease, you can develop eye symptoms, sometimes called viral conjunctivitis. So yeah, people can complain of sort of redness in the eyes, watery eyes, itching.
Those new symptoms are also usually being seen with a cough or a fever.
Parsons says Missouri, at 40.5%, has responded at a higher rate than much of the country. The national response rate is 38.4%. People who do not respond online or by phone will get a mail-in form. Kyrian Lee has looked into the changes made to accommodate the coronavirus. She is live in Columbia with more.
Yes, even with the pandemic at hand, it's crunch time for counties across the state to make sure every resident is counted. I spoke with Sarah Hum with the city of Columbia, who says the U.S. Census Bureau has put a halt to door-to-door follow-ups about the 2020 census until April 15th, and they will continue to monitor the situation as the outbreak continues. She says people have until mid-August to respond to the census rather than the original date in July. Sarah says the COVID-19 outbreak has sent many college students home for the summer. However, they're still counting on those who reside in the county to fill out the questionnaire. As of 4:30 p.m., Cole County has a self-response rate of 45.3%. Boone County is at 41.7%. And Callaway County is at 39.9%. Again, the response rate across the state right now stands at 40.5%.
What's at stake is if for every child and for every adult that's not counted in the census, we're losing about $1,300 per person per year. So if you look at that over that 10-year time span, that's $13,000 per person. And a lot of our nonprofits could do so much with that money. And when we're looking at kind of what that goes into, we're looking at school breakfast and lunch programs. We're looking at programs for veterans, healthcare.
And that list does go on. The census is confidential and secure, and it takes about 5 to 10 minutes depending on how many people are in your household. Again, that can be done by phone, mail, or online. And to learn more, you can visit our website, krcgtv.com.